Yeah. Good afternoon, Path. I want to share about Dr. Emil Devley Trust as best as I can. Um, Dr. Devley Trust is headquartered in Mumbai, though the area of operation is outside Mumbai. Now, the moment you talk about Mumbai, what comes to your mind typically is high-rise buildings, crowded locals, and on the other hand, slums, garbage heap, and so on and so forth. But then, in spite of it being a city of or the commercial capital of the country, and so much riches there, it's sad that there are still rampant health issues, and these are not just related to the crowd or the slum population, but we still find low birth weight babies there. Malnutrition is very high. Untreated cataracts are very high. Of course, substance abuse, hygiene-related issues, and a whole variety of rampant health issues which are there. And we've realized the only reason for this is the accessibility and affordability. Whatever is accessible is not affordable, and if you go to the government hospitals, then you don't really get the treatment that you need. Most of the times, they're not even accessible. So these are the problems in cities itself. Our guru, Dr. M.L. Dhawale, in whose name the trust operates, he always told us one mantra that no one should ever be denied any health care only because he or she was not able to afford it. And unfortunately, he passed away very early in his age. But his students, who obviously treated him like a god, started the trust after his demise in his name. And they followed this mantra very well. In fact, I would say one of the biggest achievement of the trust has been that these young students who were in their 20s then started the trust, and now about 37 years later, in their late 50s, early 60s, the whole team is still together, which I think is a major achievement for any kind of a trust. Of course, the services that we offer to our beneficiaries notwithstanding, but the fact that the whole team is still together really speaks volumes for the teachings that Dr. Devley gave, and the fact that his students continue to follow that. So they started a small clinic in Jogeshwari, which is a suburb of Mumbai. This was another clinic in Malad, the photographs that you see. And subsequently, from serving 4,000, 5,000 people in a year, the footprint has now really grown. Almost, I mean, I wouldn't say pan-India, but in three states, Gujarat, Maharashtra, and Karnataka. And we have about three hospitals and several clinics across these various cities: Mumbai, Pune, Kolhapur, Sumeru in Gujarat, Bangalore in Karnataka, etc. And so now the three hospitals that we have, each has a unique characteristics, and each serves a different kind of a role. The hospital in Palghar, which is our biggest hospital, it is a multi-specialty hospital, 100-bedded, and serves a pretty large population of Palghar town as such and the nearby villages. Now, what we did there was we kept on adding a new service as per the community needs. For example, the first picture that you see here is the neonatal ICU. Because of the underage mothers, very anemic, malnourished themselves, so the prevalence of babies being born under 2 kilos, under 1.5 kilo was very high. So they needed a neonatal intensive care unit, which is one of that. Then the dialysis was again not available anywhere in Palghar region. So the patients had to travel either to Vapi or to Mumbai. And you may understand for dialysis, that's very difficult. So we started that. Then we kind of started with several different kinds of surgeries, which were not affordable to common people then. So every new specialty that we added in the Palghar hospital was actually a demand of the community, and our social workers continued to assess what was the latest need and moved on to the service thereafter. The other very pressing need was a geriatric care center. Actually, it's more of a hospice than just a care center. So dementia, Parkinson's patients get looked after over here. We have about a 20-bedded ward just for these senior citizens. This is the second hospital, which is about 35 kilometers from Palghar city. It's in a remote village, and it predominantly serves about 25 villages of this nature, which are otherwise inaccessible. Even our mobile van finds it quite difficult very often to reach these villages. So it's parked outside the village, and then we serve the patients there. Mother and child care, the first 1,000 days of a child is the most critical project here. It starts with PNC, goes on to giving supplements during ANC, and then continues through the postnatal care. So this is our largest project. And then, of course, malnutrition is the second largest project, where if after all these efforts, the child still continues to be malnourished, then we treat the child further to make sure that he or she is outside the clutches of malnutrition. Malad, I mean, it's for the namesake, it is Malad in Mumbai, but it actually is in a slum area called Kurar. So in the Kurar village, we have a huge, well, not huge, 25 bedded hospital, predominantly serving the needs of that slum community, like deliveries, C-sections, ophthalmic surgeries, and a whole lot of other laparoscopic surgeries also that we perform there. Apart from these three hospitals, the Dhawale Trust also has two colleges, because we did want to spread education as best as we could. So there's an undergraduate college and there is a postgraduate college that the trust serves. Now, one of the most important thing that I had kept hidden from all of you so far, because that's really the key success point, I would say, for the trust, and that is our entire treatment is based on homeopathy. The undergraduate college, the postgraduate colleges are also homeopathic, and the hospitals, well, obviously the inpatients have to be given allopathic medicines. But the moment they're outside the surgery and in the post-operative era, then we immediately switch to homeopathy. And we've had immense amounts of success. People have great misconceptions about homeopathy, I should say. But I'd like to cite one case, actually. There's a school in Bopoli, which at one point in time, early in the morning, three children were brought by the teacher with high fever. By late afternoon, the three became 10. By late evening, it became 40. And next day morning, it was 75. So we knew that this was some kind of an epidemic. And by the way, this was pre-COVID. So words like quarantine and epidemic were not known by normal people. So we immediately quarantined those 7,500 odd children and administered one medicine. And you'll not believe it, but in 24 hours, the fever came down, and 48 hours later, the children were back in their classes and or on the playground. So homeopathy is really very powerful. It has great remedies. Of course, it was an uphill task to convince the ruler and the tribal people about the benefits of these simple looking white pills, and actually similar looking white pills, but for different remedies. So I wanted to share that with all of you, that the entire treatment actually happens using homeopathy. Like all of us, all who are working in different sectors, the reward is always the smiling faces, be it of the children or of the mothers or of the senior citizens who have just recovered their lost vision. So this is our reward. Now, we all know that mere health is not enough. So apart from the health, we also do several other community development project. The one of the most important one in that is education for standard 6, 7, 8, and 9th, where we teach them the basic math, science, English, as well as computers. Then we work with about 50 odd Bachat Ghats, which consists of about 500 odd women, and create livelihood opportunities for them, be it poultry, goatery, fishery, sewing, and a whole lot of other activities that we do. We also work with several farmers and do the water conservation projects for them so that they're able to cultivate after monsoon. In fact, one of the best advantages that we've had of this water conservation project is that we were able to effectively reduce migration down to zero in the villages where we have worked. Otherwise, post monsoon, everybody would migrate to cities in search of job. So that's the overview of the trust that we're working with, predominantly health and a small portion in the community development area as well. What is it that we're doing with Samanvay? We're using the Samanvay's Avni platform in the second hospital that I spoke about, Bhopoli, and 25 villages around that. We have a team of 45 community health workers. So they go from door to door, home to home, village to village, and gather data of adolescent girls, mothers, children, and everyone. And then that data gets transcribed into Excel sheets back at our center. We wanted to avoid that, and Avni came to our help, where now we will capture the data at the source. It'll have a better control and a better follow-up mechanism because of that. And the data will get directly uploaded, so it doesn't have to be transcribed, and hence errors will be reduced. And of course, it will help us analyze the data in a better format and do several other research programs that we are running. So that's all that I had to say about Dhawale Trust and what is it that we're doing with Samanvay.